All right, then. So on this leg of the program, we're trying to see how we broaden the horizon for environmental health officers in Lagos State. And joining me in the studios this morning, Dr. Daniel Yominiya Peters is here. He's the Dean School of Environmental Health, Lagos State College of Health Technology. It's nice to have you join us this morning. Good morning, Doctor.
Good morning. Thank you very much.
And how are you doing?
I'm good.
It's your very first time of being on Traffic Radio, I suspect.
This is my very first.
What do you make of our studios?
Oh, it's beautiful. It's okay.
All right.
It's quite very cool and attractive.
Attractive. So look to the cameras now. You can see the roads from here. What do you make of it?
Oh, the road is good. It's all right. The last man really trying their best to keep it in order.
Right.
And it's okay. It's okay. Lagos State is right.
Which of those areas can you identify?
I can identify Ojota. It's a change. I know the place very well. That's where.
That's why you drove through.
Yes.
Okay.
Yes.
Which other location can you identify there?
Let me see.
Bagada.
Yes.
Okay.
Yes.
So it means you are quite familiar with the roads.
Exactly.
Okay then. Let's jump in on the focus this morning, Dr. Peters. By way of concept clarification, who are those we refer to as environmental health officers?
Environmental health officers are trained personnel that are responsible for detecting and abating nuisances around the metropolis, both in the rural areas and urban.
Okay. So they are responsible for detecting and abating
nuisance.
Environmental nuisance.
Yes.
Because we have to put it in context. Environmental nuisance. So what do you mean by that?
Environmental nuisance are those factors in the environment that can constitute health challenges.
Okay. I need you to project more to that microphone so we can hear you very well.
Okay.
Yes. So there are factors that can
impede human health. There are things people do. There are things people fail to do, and there are things done wrongly. Those things can constitute nuisance. They impose a lot of health hazard to the public.
Right. So environmental officers are the ones that check it.
Yes.
So they are more or less like the environment police.
Yeah, they are the environment police. Yes. Well, in some countries they are known as environmental police.
Okay. But we cannot ascribe that to them here like that.
We are called environmental health officers.
All right.
In Nigeria.
So when you look around today, it appears the environmental health officers have become rare species. So how relevant are they in the environmental sustainability equation of Lagos as it stands today now?
The environmental health officers are quite relevant. I will let me take you beyond to a certain level. Diseases originate from the environment. In my own school of thought, there is no disease that is not environmental oriented. People's behavior leads to different kind of diseases.
Right.
And environmental officers are the grassroots officers that move from place to place. They go from house to house to detect nuisance and to educate the masses on issue of nuisance.
Okay.
They carry out health education. They enforce the law. Okay. They enforce the public health laws.
Right.
Okay.
Right. So they enforce laws?
Yes.
Yes. What else do they do?
And they ensure that the nuisances are abated.
So they are still very relevant. That's what you're saying.
They are very relevant.
But we rarely see them.
Well, I think it's a matter of policy. In those days, when the population was not as high as this, you see them everywhere. But now you can imagine Lagos population and the number of environmental officers that are in operation. They are quite few. Talking about the population of Lagos State, they are very few.
Right. So in terms of requirement and in terms of the need, what does the World Health Organization say about the status of an environmental officer to a particular population?
Yes, by the WHO standard, we're supposed to have at least one environmental officer to about 800 people. So
one environmental health officer to 800?
800.
And in Lagos, we're over 22, let's say 24 million?
Million, yes.
Do we have enough of them?
We don't have enough.
Why is that so?
Well, that is based on government policy. There are a lot of environmental officers newly graduated from the schools.
Right.
But they are just there, not gratefully. Some of them are even working as ECOMOG. We call them ECOMOG because where they are not yet employed,
right,
they are just assisting the employed ones to make sure that things are properly put in order in Lagos State.
Right. So you are Dean School of Environmental Health, right?
Yes,
for the College of Health Technology.
Exactly.
What roles does institutions like yours play in the sustainability of health, environmental health officers?
The Lagos State College of Health Technologies are at the forefront of training of health personnel.
Right.
Especially on the area.
You're still not projecting to that microphone. We can hear very well. Yes.
Okay.
So,
the Lagos State College of Health Technology is at the forefront of training of health personnel that are specifically in charge of preventive. The Lagos State College of Health Technology started in 1920 when there was outbreak of malaria. You know, in those days, malaria, nobody could find out the cure for malaria. When the white men were here in Lagos and they were dying of malaria. So suddenly, when Dr. Isaac Oluwole returned from UK after his training as a medical doctor, he out of his own personal
evolution,
he decided to look for the cause of this malaria that is killing the whites. He now brought the idea, what is the cause of malaria? He said it's mosquito. So what do? Let us look for where mosquito stays. Now he now brought up some boys to look for mosquito. In those days, environmental officers of today were called mosquito scouts.
You mean it?
Yes.
This was around what years?
That was before 1920. Even 1920.
Right.
They were called mosquito scouts.
Mosquito touts. Scouts. Okay.
Yes. Because all they do is to move from one place to the other, look for where there is bad water receptacles that can breed these mosquitoes. So that is why where the name came from actually. That's what, you know Yoruba called environmental officer Wole Wole those days. The name Wole Wole actually was coined out of the fact that they moved from house to house to look for these water receptacles where mosquitoes could breed.
All right.
So that went on, and it was later discovered that the effort of these guys were actually bringing out something that led to the adoption of the profession. It was later called sanitary inspectors.
Right.
So the first curriculum-based training, because the first training was not actually curriculum-based. It was just an initiative of Dr. Isaac Oluwole, who just wanted to make sure that he discovered the cause of this malaria. But when the effort paid off, they were adopted and later called sanitary inspectors.
All right.
So they were licensed by the School of Hygiene in London. Then, because the exam was conducted by the School of Hygiene,
right,
in London. So that's why they were called. The first certificate was Royal Society for Health, RSH. Then,
right.
It was later, as time goes on, it was adopted and the name changed. And then the Lagos State College of Health Technology was now established to actually train them. That is why the Lagos State College of Health Technology is the first college of health in Africa.
Okay. So, and ever since you guys have been churning out lots of graduates?
Yes, we taught a lot of
So I'm wondering if you now say you guys have been contributing to the sustenance of environmental health officers, how come we still having shortage within the population?
Well, as I said earlier on, that depends on government policy. The Lagos State government has actually been trying, especially this present regime, where any officer who is retiring is replaced. And from time to time, they were employed. In recent times, some were going and others were coming in. But you see, the population, the demand is high.
It's very, very high.
Very, very high.
Okay.
The officers are still there. So I honestly, I thank the Lagos State government for the initiative of employing environmental officers.
Right.
But we still need more.
Okay, then. So flash update says the broken down loaded 40-foot container Mark truck, which is having mechanical bearing problem at Dorba Junction inwards Mazamaza has now been taken off the road. So it's a much better movement there if you are driving through that corridor. Talking about mile 2 end. So that broken down truck at Doba, inwards Maza has been taken off. So it's a much better drive right now. All right. So you said you guys have been contributing a lot to the sustenance and, of course, the sustainability of environmental health officers. But let's dwell beyond that now and talk about, what is really happening. You said their roles are very, very relevant, but do you have this kind of feeling that maybe the emergence of some other professionals seems to be taking the shine of the environmental health officers?
Yes, that has been a challenge. And we've always advised the authorities to put a round peg in the round hole. If you are not a trained environmental officer, you cannot practice environmental health. Environmental officers are trained for 4 years. In fact, it's now 5 years. And we have a board. The board exam that they write, and then licensing council, the Environmental Health Registration Council of Nigeria. So these people monitors the practice of environmental health. What we are looking at today, you see, the field of environmental health is evolving. It was not like as it used to be those days. So within the profession of environmental health, we are trying to look inward into how do we make it more scientific. Like in the olden days, the practice was just one way.
Okay.
But today, science have improved, and innovations have come in. You know when we talk about sanitary inspection of premises those days, it was like you just move from house to house. You ask the people, where's your toilet, where's your kitchen, and all that. And
right.
all that.
Has it changed now?
Yes, it's changing because the system requires that it must be more scientific.
Okay.
We are talking about sustainable system, a system where data are collected. I give you an example.
Talk to me.
If we have data about the number of houses in Lagos State,
right?
If we have data about the number of people living in a particular location, we'll be able to determine the waste generated. The greatest challenge we are facing in the environmental health sector is waste management. And Lagos State is spending a lot on waste management. But we are looking beyond this the system. We are looking to a system where collection of waste will be more scientific.
Okay.
Generation of waste will also be scientific. Data collection. For example, if we have, let's take a local government for example, and the local government will know the number of houses on a particular street.
Right.
And then in those houses, there are people living there. I will now say, okay, everybody must know the volume of waste you generate per day.
Okay.
If we know the volume of waste generated per day, we can advise Loma on this street about 200 tons of waste is generated in a month.
So who's supposed to carry that out? That data.
That is a scientific aspect we are going into.
So is that part of your duty? Is that part of what you should do?
Yes.
Okay.
Because you see, environmental officers are present, not the local governments, and then they are in charge of. They are the grassroots officers.
Right. So, but this is what you are saying. This is an idea. Are you very sure that those who are environmental officers, are they aware that they should do this?
Yes, they are aware. You see, the impediment is resources to perform their duties. For example, the environmental health of a typical environmental officer needs a setup, an office setup, where you have the systems where data can be imputed.
Right.
They go to the field, collect the data, and upload them into the system. There's what we call monitoring and evaluation to assist in monitoring the environment. If a plot of land was vacant yesterday, and suddenly somebody bought it and started building, an environmental officer must be there to monitor the approved plan and whether their approved plan is followed.
Right.
And that will be imputed in the system.
Which is very good for environmental sustainability. Now, these are some of the emerging issues, right?
Yes.
You just mentioned one now that relates to waste collection and disposal. What else? What are the other emerging issues that you feel the environmental health officers should be aware of?
Now, today we talk about open defecation.
Right.
Now, from the environmental health point of view, it's the duty of environmental officer to go from house to house to determine whether houses actually have the required number of toilets. It's not just having toilet. If you have about 20 people in a house and you give them one toilet, that is not enough.
It's not sufficient.
It's not sufficient. So we are saying that there should be an enforcement. If you have a house, you build a house, what number of people? Say 10 people. The house, the toilet must be available for them.
Right.
And not only that, we also advising government. You see, we have Lagos State is a state, it's a vast state, and we're talking about providing toilets in every corner of Lagos. And
population keep growing every day.
Yes.
So have you been able to ascertain that? I mean, is this something that you worked with? Is this something that environmental health officers can do, or they need to collaborate with the Ministry of Environment and all of that?
They are also there in the Ministry of Environment. We are there, Ministry of Health, Ministry of Environment, and in fact, there is no ministry environmental officer shouldn't be.
Right.
Because anywhere they generate refuse, anywhere there are people, environmental officer must be there.
I need to bring your attention to certain areas, and I don't know if you work with the environmental health officers, the association, for instance.
Yes.
There are some localities you go to, there's some communities you go to, and what you smell, I mean, the smell that comes in from those places is certainly something not to write home.
Yes.
It's very, very bad.
That is it.
And you begin to wonder, is this part of Lagos?
It's part of Lagos. You see, another thing I want you to understand is political will. You see, the environmental officer cannot work beyond the interests of the authorities. If the government give us a go ahead and do this, we go. And if the backup is there, political backup, an environmental officer can abate the news, all those smelly places within a short time. You see, we also have issues with enforcement.
So are you aware of those places I'm talking about? That
yes, I'm very aware.
If you go to certain places in Mushin, for instance, there's no way you would drive through some of those streets, you won't, the stench that comes from those areas. There's a location even around Acme. By the time you drive through, you begin to wonder, do environmental health officers visit this area? Are they there to bring some levels of correction? What are they been doing?
They are there. See, we're still talking about number. If we have, let me give you an instance. If you have about 50 environmental officers in a local government where you have over 6 million people, and you are having about 20 environmental officers, that is not enough. And the streets too, they have to. You see, environmental officer is a field worker. They move from street to street to detect nuisance. And if they are not enough, in Lagos is such a place that when you abate a nuisance today, just carry out enforcement today, come back there in the evening. Everything is back to status quo.
Right.
So that is the nature of Lagos. So that is why environmental officers work throughout. You see, if they are empowered, they work throughout the night, throughout the day, looking for the author of nuisances.
Right. So do they have the powers to arrest?
Yes, by law. The environmental officers have the power to arrest. But in this part of the world, to arrest, even with guns, you are not respected. Not to talk of arresting people without gun. In a civilized world, if a simple pronouncement of "please, you are under arrest, can you follow me?" it's okay. But in this part of the world, if you carry your gun, they will still struggle with you. We've seen situations where environmental officers are beaten just because people were asked to abate nuisance. The place you said you refer to as smelling places. The nuisance created are mostly created by these touts, these area boys, who don't have toilets. They're the ones that defecate all over the place. They dispose their refuse anywhere, anyhow.
Right.
But what we're advocating, anybody that will live in a house must have an order, system of disposing refuse. You must have a toilet. An environmental officer must ensure that. And if the person does not have, why are you in Lagos if you have no house to live?
Right.
If you have a house to live, why is the house not providing the necessary requirement, the amenities for you to use? That is a challenge.
Right. Okay, then we'll talk much more about some of those challenges confronting health officers and what you are bringing on board, because I understand you have a book, right?
Yes.
Okay. We'll talk about that as the program moves on. This is Your Side Mirror, this beautiful Monday morning. And this morning, we're trying to see how we broaden the horizon for environmental health officers in Lagos. And Dr. Daniel Yominiya Peters is joining us. He's Dean, School of Environmental Health, Lagos State College of Health Technology. Let's get back to the roads right now and let you in on the latest gist. Most of you making that journey to the island, I understand it's still pretty good if you want to make use of the third mainland bridge. All right, but a flash update here says damaged expansion joints on Ogudu Ifako Bridge inwards Yanowuru Island is the cause of the slow movement of traffic backlogging to the toll gate. All right, so the latest update right now says it's now slow. Those of you coming in from the toll gate approaching Alakbare down to Ogudu, we have the damaged expansion joint there affecting your movement. But the traffic managers on ground trying to sort things out within that particular corridor. So that's the flash update that is coming in at this time. Let me see if we can get you some more as you drive through Lagos Abeokuta Expressway. Yes, the usual suspect. Yes, that is within the National Ikeja Long, coming in from Ilezik down to National. You might have it slow there. That's a merging point where you have 4 lanes. Yeah, and begins to thin out to 2 lanes by the time you approach National. But beyond National, it gets much better right now. Okay, then, if you have any issues on the road, you can always escalate that to us, and we'll be able to send that in to the traffic managers as well. So let's get back to this. So, technology. What roles can technology play in broadening the horizon for environmental health officers? Yes. Dr. Peters.
After so many years of practice in the field, I begin to imagine, how do we solve these problems? And I concluded within me that solving certain problems, we must be scientific. And being scientific, we follow particular methods. And those methods, backed up by the authorities, will go a long way to solve the environmental problems in Lagos State. And that is why I went to writing this book to make the premise inspection to be more scientific. I tell you, if we can perfect our sanitary inspection of premises, most of the problems will be solved.
Why do you say that?
Yes, one, where if you are living in a particular house, the government must know that you are there.
Okay.
I give you an example. Yeah, and if the government knows you are there, you must be able to account for your activities. You are generating refuse. You are using water. You cannot be defecating openly. If you have 5 children, for example, we want to know, how do they live? Where do they have, what waste are they generating? And then the water they use. If we have all this data in our hand, if there's a nuisance anywhere, like the smelly place you mentioned earlier on, we'll be able to say, who generated that refuse? Why is the environment polluting? Where is there pollution of the environment? We'll be able to detect that. Environmental officers also visit industries. We must carry a thorough sanitary inspection of industries, marketplaces, food eateries. We also inspect shops for expired products, like you get to some cold rooms, you see rotten fishes there.
Right.
The environmental officer carry a thorough inspection. If we know there's a cold room there, you know there are so many hidden places in Lagos.
All right.
That cannot easily be assessed because there are no enough hands to assess it.
Yeah. So and that is where I'm talking about duplicity. You know, sometimes we have other agencies whose jobs might more or less be in tandem with yours.
Yeah, okay.
So how do you now determine who does what at every point in time?
Well, there shouldn't be any need for somebody intruding into a profession is not trained to do. You see, the civil service is so specialized that everybody coming to the service have a role. People duplicating roles can lead to these abnormal issues, because not only duplicating roles. Okay, we have the local government, for example. We have the Minister of Health. We have the Minister of Environment, playing the same role.
Right.
Now, if somebody in the local government, if an officer from the local government visited the premises, carry out a thorough inspection. In those days, the local government give report to the states. So for any follow-up that the state want to do, right, they must work in collaboration with the local government. You cannot just come up and say, okay, I'm an officer too, or the police do the job of an environmental officer, or any other person, or even scientific officers do the job of environmental officers. That is not what they are trained to do, and that is where the abnormalities come from.
All right then. Lagos Traffic Radio 96.1 FM. Dr. Daniel Yominiya Peters is our guest on the program this morning, and we're looking at best ways of broadening the horizon for environmental health officers, aka the Wule Wules. When did you see them last in your neighborhood? You can, connect with us this morning and share your thoughts on 08099120777. That's 08099120777 and 09153877127. Share your thoughts with us, or perhaps you have any questions for the guest this morning. Feel free to connect with us as well. Dr. Daniel Peters is here and is here to respond. All right, then, the update. We did tell you, those of you trying to make use of the Third Milan Bridge earlier on, the road to the Third Milan Bridge, very good. But right now, I understand it is pretty slow at Ogudu. The expansion joint there is affecting movement. Those of you coming in from the toll gate and Alakpore trying to connect with Ogudu. The expansion joint affecting your movement, and so it is pretty slow within that particular corridor. Beyond Ogudu, connecting Yanowuru and the Third Milan Bridge is looking pretty good. All right, messages coming in. This one says, good morning, Victor and Dr. Daniel. How can environmental health officers address challenges posed by Lagos rapid urbanization? Thanks, Aki from Sulere is sending that one in. So, how can they cope?
Well, the first point I want to raise here is the employment of more environmental officers, and sending them to specific areas. If we have more of these officers, there will be total coverage of the areas. For example, we don't have, without having more of these people, there is no way. And another area I want to advocate is there should be a retraining. I talk about scientific innovations. Mm-hmm. Officers on the field now should be retrained. Retraining, attending seminars and workshops, of course, which is the Environmental Health Officers Council is doing currently, regularly. And the challenges we have with most of these things is that for an officer to be retrained, requires some funds. Even the state government can even organize, the board can organize, the primary care board can organize retraining. When I mean retraining, you see, the way things were done in those days is different now from how things are done now. So employment of more environmental officers, the training of the current ones that are already in practice
is needed.
It's needed.
All right, this one says, Dr. Peters, in your opinion, what are the key obstacles preventing strict enforcement of environmental laws, such as the styrofoam ban? Styrofoam ban. Dr. Yusuf is sending that one in. So, what's preventing that?
Yes, the one of the greatest challenge the environmental health faces now is enforcement. Enforcement. In the olden days, we used the law, the courts, to enforce the public health laws, and people comply because nobody wants to be taken to court. But today we have some challenges. The customary courts are no longer allowed to enforce the law, to carry out prosecution of offenders. And then the way the whole thing is coiled, it's like it makes it difficult for the local government personnel, the environmental officers in the local government, to carry out enforcement. The bureaucracy involved in prosecuting an offender now is unbearable. It makes the work very difficult. So what I would advise the states or the authorities to do is to liberalize this prosecution system. Let the courts, or even if you are not using the customary courts, the court should be available in all the local government for easy prosecution. If these things are not available, there's no way an environmental officer will just, okay, you want to prosecute somebody in Ikeja, in Mushin.
All right.
You have to move on to Ikeja. It sounds somehow.
All right.
So let it be decentralized as it used to be those days. Let each local government have its own authority.
Okay.
To prosecute offenders.
Especially for this styrofoam ban, right?
Yeah, this styrofoam ban. Styrofoam ban, there are people still, the other day was just yesterday, I was just passing through Ikeja and I saw they still serve food with styrofoam ban. I was wondering.
Wow. Okay, Dr. Yusuf, I hope that answers the question. This one says, good morning, Traffic Radio. What steps can strengthen disease monitoring and reporting systems in Lagos? You didn't put your name. So what steps can be done to strengthen that, Dr. Dan Peters?
Yes, there's what we call monitoring and evaluation. I said again that diseases originate from premises. If we must monitor diseases outbreak, let us start with the premises. Let us start with the people.
Okay.
Now, if you discover that there's outbreak of this, let me give you an example of COVID-19.
Mm-hmm.
The issue of COVID-19 and some other diseases like Lassa fever or so actually came up because of abandonment and carelessness.
You mean it?
Yes. Okay, I give you an example. Let us look at what's the name of this disease now that Dr. Sawyer brought in.
Yeah, that Ebola.
Ebola.
Right.
He passed through the ports. Under normal circumstances, environmental officers are there in the ports to screen those coming in. Their cards are there. If anyone is suspected to be a carrier of any kind of infection, is quarantined for a period of time. The incubation period of the disease before it's released. So why should somebody just travel from another country without being monitored? That is one. Now, even within Lagos, diseases will continue to spread if they are not monitored from the hospital. If you go to some of our hospitals, sorry to say this, there are some hospitals you go with another disease, and if you are not careful, you come out with another disease.
You mean it?
I give you an example.
Give us.
I asked there was somebody complained about hospitals filled up, that no bed to admit patient. I was worried. I called my student. I said, okay, all of you, I'm sending you to Lagos, Lagos, and go to the general hospitals, find out what's the most common disease in this hospital that's making people to be admitted all the time. They went, and honestly, 90% of the reports were malaria. Malaria. Then I said, malaria in Lagos State. How? Everybody malaria. But this one is having malaria. Well, though the diagnosis is a little bit queried, but notwithstanding, malaria is endemic.
That's right.
And how do we cope that?
All right, let's see. More responses are coming in here for you. This one says, what roles do environmental health officers play in managing sanitation in crowded markets like Balogun, Idumota, or even Mile 12? Habib is sending that one in.
Well, it still boils down to the population. For example, if in Balogun market, the population is vast. And what I advise, like this premises special book, what I put there is, every store in the market should be monitored. Who is the owner of this store?
All right.
How are refuse generated this store disposed?
All right, we'll come to that book very, very shortly. This one says, amazing morning. Victor, please ask the guest, how can the issue of open defecation and choked markets in Lagos be tackled effectively? Thanks. This is coming in from Lioni from Oshodi. So how can that be checked? Open defecation?
Okay, let me start with choked
markets.
Choked markets. I still go back to data. Before markets are given to people, Do we have data of the number of people in that market? Where would they sell? You go to the streets now, you see overhanging structures everywhere. The road has been turned to markets. So the question is this: do we have data of these people? Who give them the show? Who authorize them to use the place? Are they registered? A lot of food sellers on the street, are they registered? The market is filled up. Because we don't know who brought them in. We cannot tell who registered, whether they are who registered, whether they are disease carriers. There's what we call food handler certificate.
Right.
Do they have food handler certificate? Are they authorized to sell food? Are they authorized to sell in the eateries? These are the issues.
Right.
And nobody monitors until we go back to the basics.
So let's come to the recipe that you are bringing on board, Dr. Daniel Peters. What are you bringing on board to at least add your voice to the solution?
Yes. This book is Practical Premises Inspection Manual for Health Professionals.
Practical premises inspection.
Yes.
All right.
Manual
So
for
what are you
health
saying in the
professionals.
book?
Yes, in the book, I try to bring to focus the scientific method of carrying out premise inspection through data collection and fact findings. Like we need to, there's a portion there that talk about laboratory analysis, where you collect this before you approve anything. That you must be sure that this thing is consumable. And in every home, data must be available.
Okay.
Where is the house located? How many people are in that house? What is the level of revenue they generate on daily basis?
All right. So this book has how many chapters?
About 12 chapters.
12 chapters. And it's going to be unveiled when? When is it going to be unveiled?
On the 19th of December.
Okay, which is 10 days time.
10 days time.
All right. So who can be part of that, and how can people, by the time it's unveiled?
Yes, we are carrying out advocacy to try to change the perspective of the public, perception of the public, and so everybody's invited.
Okay.
The professionals especially, because we try to change the system of premises inspection and to make it more scientific. So all environmental officers on the field are
invited. And where's it going to be holding?
It's going to hold at the Lagos State College of Health Technology multipurpose hall.
Okay. All right. That's in Yaba, right?
Yaba.
Okay, then. So I wish you guys a very, very nice time. And I hope that by the time this book is finally unveiled, it will add to the body of knowledge that would seek to advance the cause in terms of bringing solutions for environmental sustainability and sanitation in Lagos. Your patent thought on the program this morning, Dr. Daniel, Dr. Dan Peters.
Yes. I want to use this media to inform all our officers to be prepared for a change, and also to inform the public that diseases originate from premises. Everyone in Lagos State should take care of their premises and not to be hostile to environmental officers, because we have received report of hostility. You see an environmental officer coming to your house, it's like your enemy is coming. Because nuisances you are out of nuisances.
Right.
So I'm advocating that please, the public should welcome the environmental officers as they visit houses. They should be open. The environmental officer is there to help you, is there to assist you, is there to protect you from diseases. So it shouldn't be your enemy.
All right. We'll leave it at that for now. It's nice having you in the building. Thank you so much for being here.
Thank you very much. I'm glad and I'm grateful for your questions, and I really want to appreciate you so much for inviting me.
Okay, then.
God bless you, sir.
Thank you. So we've tried in our own little way to broaden the horizon for environmental health officers in Lagos State, and we've done that through the excursion of Dr. Daniel Yominiya Peters. He's Dean School of Environmental Health at the Lagos State College of Health Technology. We have to go this morning.
And I just want to appreciate my provost.
Okay.
The provost of the Lagos State College of Health Technology,
and
Professor Rahim Akeusola.
All right, then.
He has been very helpful, very hardworking, and very proactive.
All right, then. Big ups to him, then. So, producing this morning, Akan Hussein. Say big thank you to you. Olushoga Oluwatoni and Jessica Ali in the building as well. Deborah Bolodeoku and Okwemi Shodunke of our social media unit. Our executive producer is Tayo Akonle. My name is Victor Oteri. Have a splendid day. Bye.